Tay Sachs disease is a genetic disorder. Look at this picture, shows that gene factors and disease mechanisms. CT scan and MRI shows brain atrophy in advanced cases. Look at this. A detail going on. Introduction. Tay Sachs disease is a rare inherited neurodegenerative disorder that affects infants, leading to progressive deterioration of the nervous system. It is caused by a deficiency of the enzyme hexosaminidase A, which results in the accumulation of hormonal substances in the brain and spinal cord. This condition is fatal, with most affected children not surviving beyond early childhood. A definition. Tay Sachs disease is a genetic disorder caused by mutation in the HEXA gene, leading to a deficiency of HEXA enzyme. This deficiency results in the accumulation of GM2 ganglioside, a fatty substance in nerve cells, ultimately causing neurodegeneration. Etymology. Tay Sachs disease is named after British ophthalmologist Warren Tay, who first described the characteristic eye abnormality in 1881, and American neurologist Bernard Sachs, who identified its cellular pathology and notes its prevalence in Ashkenazi Jewish population. The term combines their surnames to recognize their contributions to understanding the disorder. Types. 1. Infantile Tay Sachs disease. Classic form. Symptoms appear around 3 to 6 months of age and rapidly progresses. 2. Juvenile Tay Sachs disease. Symptoms start between 2 to 10 years of age with a slower progression. 3. Late onset Tay Sachs disease. LOTS, a milder form that appears in adolescence or adulthood, often leading to movement and psychiatric problems. Causes. Tay Sachs disease is caused by mutations in the HEXA gene on chromosome 15, leading to a deficiency in HEXA enzyme. The HEXA gene mutations prevent the breakdown of GM2 gangliosides, causing toxic accumulation in neurons. Risk factors. 1. Genetic inheritance. Autosomal recessive disorder. Both parents must be carriers. 2. Ethnic predisposition. More common in Ascais Jews, French Canadians, Cajuns, and certain Pan-Slovenian Dutch populations. 3. Family history. Increased risk of there is a family history of disease. 4. Carrier parents. If both parents are carriers, there is a 25% chance of passing the disease to their child. Complications. 1. Progressive loss of motor skills. 2. Blindness and deafness. 3. Seizures. 4. Difficulty swallowing. 5. Increased risk of respiratory infections. 6. Death, usually by age 4 to 5 years in infantile Tay Sachs. Pathophysiology. Pathophysiology of Tay Sachs disease. Step by step process. 1. Genetic mutation. Tay Sachs disease is caused by a mutation in the HEXA gene on chromosome 15. The HEXA encodes the beta hexosaminidase A HEXA enzyme, which is essential for breaking down GM2 ganglioside, a type of fatty substance in lysosomes. 2. Deficient enzyme function. The mutation leads to deficiency or complete absence of HEXA enzyme activity. Without HEXA, GM2 ganglioside cannot be properly degraded. 3. Neuronal lysosomes, particularly in the brain and spinal cord. The lysosomes swell and form onion skin, cytoplasmic inclusions seen under a microscope. 4. Progressive neuronal damage. The excessive GM2 ganglioside interferes with normal neuron function, leading to progressive neurodegeneration. Neurons lose function, leading to muscle weakness, loss of coordination, and cognitive decline. 5. Symptoms onset and progression. Symptoms typically appears around 3 to 6 months of age and include loss of motor skills, hypotonia, which means weak muscles, and increased striatal response. As the disease progresses, it causes seizures, vision and hearing loss, paralysis, and eventual death, usually by the age of 4 to 5 years in the infantile form. 6. No cure and lethal outcome. Due to the lack of effective treatment, Tay Sachs disease is fetal in its most common infantile form. Research is ongoing for potential therapies such as gene therapy and enzyme replacement therapy. This step by step breakdown highlights the genetic base, enzyme deficiency, lysosomal storage defects, neuronal damage, and fatal progression of Tay Sachs disease. Signs and symptoms. Early symptoms 3 to 6 months. 1. Loss of motor skills. 2. Increased striatal response. 3. Decreased muscle tone. 4. Cherry red spot on the retina. Progressive symptoms 1. Seizures. 2. Blindness. 3. Hearing loss. 4. Swallowing difficulties. 5. Paralysis. 6. Intellectual and developmental regression. 7. Death in early childhood. Diagnosis 1. Blood test measures XA enzyme activity. 2. Genetic testing detects mutations in the HXA gene. 3. Prenatal testing amniocentesis or chronic villus sampling CVS to check for HXA mutations. 4. Eye examination identifies the cherry red spot on the retina. 5. MRI or CT scan shows brain atrophy in advanced cases. Nursing diagnosis 1. Risk for ineffective airway clearance related to muscle weakness. 2. Impaired mobility related to progressive neuromuscular deterioration. 3. Risk for aspiration related to difficulty swallowing. 4. Ineffective coping related to the terminal nature of disease. 5. Risk for caregiver role strain related to the emotional and physical demands of caring for terminally ill child. Disease management, first medical management. No cure for Tay Sachs disease, but some disease managements. 1. Supportive care to manage symptoms. 2. Medications. Anticonvulsants for seizures. Muscle relaxants for spasticity. 3. Physical therapy helps maintain mobility as long as possible. 4. Nutritional support, feeding tubes in advanced cases. Nursing management. 1. Monitor respiratory function to prevent infections. To ensure proper nutrition and hydration. 3. Prevent complications of immobility, example pressure ulcers. 4. Provide emotional support to family members. 5. Educate caregivers on symptoms management and palliative care. Treatment options. 1. Palliative care to improve quality of life. 2. Gene therapy under research aim to correct the defective HEXA gene. 3. Enzyme replacement therapy experimental stage. 4. Supportive treatments physical therapy, pain management, and nutritional support. Psychosocial medicine. 1. Family counseling helps parents cope with emotional distress. 2. Support groups connect families with others facing similar challenges. 3. Respite care provides temporary relief for caregivers. 4. End of life planning ensures dignity and comfort for the child. 5. Educational resources helps families understand the disease and available support. Prevention. 1. Carriers screening, genetic testing for at-risk populations. 2. Prenatal diagnosis. Aminocentesis or CVS is high risk pregnancies. 3. Pre-implantation genetic diagnosis ensures selection of embryos without HEXA mutations. 4. Genetic counseling educates at risk couples about reproductive options. In conclusion, Tay Sachs disease is a devastating genetic disorder with no cure. Early diagnosis, supportive care, and genetic counseling play a crucial role in managing the disease. While medical advancements offer hope for future treatment, current interventions focus on improving the quality of life for affected individuals and their families. Preventive measures like genetic screening remains the most effective strategy in reducing the prevalence of this condition. Thank you. Have a nice day.